At Trust, we deal with a lot of complex medical invoices. We had a home-built OCR tool based on templates, but the person who built it left the company, so it was not updated for a long time. It really never worked well because every supplier has a different templates, and we work with more than 700 suppliers. We also could not capture critical data fields like issue date, and we had to enter a lot of data manually. Because of this, we made a lot of errors in payments, we had poor data in our systems, and the AP team couldn't focus on other important tasks. Of course, our supplier relationship suffered as well, and on top of that, our invoice volumes have doubled in the last 5 years. The basic solution is to hire more people, but we're not that kind of company.
The people that we want to have working with us are people who have critical thinking and people who like to innovate. When you want that kind of people, you can't ask them to check invoices. That's boring.
After implementing Rossum, we completely changed the way our AP team works. Within weeks of going live, we managed to go from an automation of 80% to 85–90%. Additionally, we also look at the time we spent on each invoice, and currently we are looking at numbers of 10 seconds per invoice, which is absolutely amazing. We have complete visibility into the invoice backlog and more control over the whole process. Last but not least, we have also reduced the number of people processing invoices from 4 to 1 and reassigned those people to improving relationships with our partners.
There was a plus in this project, and the plus was about data. The thing is that now we can use it. We have, for the same kind of clinical acts, you know where they are more expensive, where they are less expensive. We also know which are the suppliers that invoice you quicker, those that take more times, the suppliers that invoice correctly on the first time, the ones that you go back and forward. Those kind of things make you evaluate correctly our suppliers, and also gives you highlights to where you have to talk to them to go better and better, to evolve.
What gave us the confidence to move forward with Rossum was that we were able to implement a complex business case right in the trial version. Another thing that we really liked was that the UI in Rossum, it was really easy to use, and we immediately started seeing results.
We evaluated other solution providers, and the pricing model just didn't work for us. First, we had to make a large upfront investment, but also we had to run the infrastructure and the software itself. Of course, all of that made us choose Rossum because we didn't have to worry about none of that.
Before Rossum, the AP department was not a very sexy department. Now, it is a very sexy department.